All right, hello everyone. My name is Alex Simmonds. I'm a current PGY3 resident at Virginia Commonwealth University. Thanks for taking the time to come to this talk. None of the authors have any relevant disclosures. Additionally, this study was done at the VA, so the views and impressions do not necessarily reflect the views of the government. Since 2003, the ACGME has instituted duty hour restrictions, limiting resident physicians to 80 hours per week, averaged over 4 weeks. This change has had an unclear impact on resident independence. A recent survey of fellowship program directors estimated that only 30% of new fellows would be able to perform a laparoscopic cholecystectomy independently. Declining rates of resident independent operating may have contributed to an increase of 80% of general surgery residents seeking postgraduate fellowship training. Little data exists comparing outcomes on resident independent operations compared to cases in which attendings are present. We sought to compare surgical outcomes in laparoscopic cholecystectomy performed by residents independently compared with those cases with an attending scrubbed within the Veterans Healthcare Administration system. We examined the VASQUIP database to compare from 2000 to 2020 using CPT codes for lap chole. We then excluded cases in which residents weren't involved or where the level of resident involvement wasn't clearly defined. We then case matched these two groups on if the attending was scrubbed during the case or if the attending was not scrubbed during the case, including for major comorbidities. As you can see on the preoperative demographics, there were no real statistical differences in comorbidities after matching. No significant difference existed in 30-day mortality, post-op length of stay, surgical site infections. The attending scrub cases were noted to be slightly longer with slightly higher complication rates. Resident independent cases were slightly more likely to require a blood transfusion. When examining the cases per year in the non-matched cohort, we can see that resident independent operating has declined sharply since 2003. Residents completed 14.6% of cases independently prior to 2003 and only 1.6% of cases after 2003. Note that this graph actually had to be configured in a log scale to even visualize the decline of resident independence after 2003. Some limitations do exist to this study. It would include the retrospective database design, which can lead to some lack of granularity, as well as the possibility for documentation bias. There was limited information on the PGY level of residents as well. In conclusion, resident independent operating has declined rapidly since duty hour changes in 2003. No difference exists in operative mortality whenever residents perform laparoscopic cholecystectomy independently versus with an attending scrubbed. Further research is needed to better define the impact of changes in resident autonomy over time. Thank you.